Hey, this is Dr. Birchlow from ChiroHealth Spine Disc Center. If you have a teenager with or child with back pain, especially if they're getting pain into their hips, their legs, especially if they're in things like dance, cheer, gymnastics, you need to pay attention to this video. Why do I have a picture of a girl doing some kind of funny handstand back bend thing here? This is the quintessential type of activity, gymnastics and girls in gymnastics that have a particular injury to their spine called a spondylolisthesis, and that's what I'm going to talk to you about here today. So in this case, when we have things like gymnastics where we're doing back bends, repeat extension of the spine, that back bending causes the bony parts of the spine to get real close together or hit into each other. And then you do that a zillion times, and that can cause a stress fracture in the spine. And in the early stages, it'll be back pain in a kid in these activities. And it can progress to they're always having back pain. And at times, while we don't commonly see this in young kids, 5, 6, 7, 8 years old, but as they start to get into middle school age and beyond, they can even have pain that seems to radiate out into their thigh or their leg or their hips or things. And that can be a sign of a stress fracture in the bone there. So if your kids are having those kind of pain or symptoms, especially if they're in these sports, they definitely need to be checked, and I would have them checked by a chiropractor, because chiropractors they're experts in the spine. This type of problem will commonly be missed by other types of providers, not necessarily orthopedic people or things like that, but family doctor and stuff. This stuff can be commonly missed. And let me show you a few pictures and why it can be missed. So here is here could be an X-ray of the spine. There we go. So in the early stages of this, you could look at the spine. This would be the lower back in this case, and the bone could look normal, yet the kid is having back pain, and they have a process in there that could result in a stress fracture. Now, if you don't look at X-rays all day, I know this can look confusing, but here's a portion of the bone in here, and it's normal. And over here, this section of bone here has a fracture. The bone has separated. And that process takes time. That's why it says stress fracture. It's not a one-time thing, though that is possible. It's typically a stress fracture. So identifying, hey, what activities is the kid in? Are they having back pain? Are there clinical signs of this? And then possibly getting imaging signs to know whether there is a stress fracture in process, to then try to have a discussion on avoiding that activity or trying to avoid that stress fracture from completing. Because once it does, it never goes back. And these things can lead to chronic major issues later in life. Oftentimes the thing that gives that person more trouble than any other thing in their life as they age. So it is important to identify and try to minimize the chance that the bone does progress to a fracture. So we can see certain things on X-rays, though sometimes we kind of know what's going on, but it's not visible yet on X-ray. In some of those cases, we order an MRI. And in the early stages, so this would be bones in the lower back. These are the bones, and the section that gets the fracture is that kind of a thin ring of bone. And on MRI, even if the X-ray looked normal, you may see the bone kind of light up, and that's a sign of swelling in the bone. Just like you sprain an ankle and it swells up, well, you hurt a bone, it swells, and it'll have that appearance even before it fractures. And if you can identify that, say, hey, this is what's going on, you can have the kid rest from those activities, maybe wear a brace for a period of time, primarily just to limit them doing that kind of thing. And just like a broken bone might need 6 weeks or so, it can take a couple months of avoiding those activities to let the bone heal up enough before resuming the activity. And those things are tough, because you want your kid to play, you do this stuff, they may want to play and be in the activity, but sometimes you have to think of the long term. Hey, we do not want this thing to stress fracture, because it will not be the same ever again after that, and so it's important to identify that, okay? If this is something you have a question on, kid with back pain, hip pain, stuff going in the legs, feet, why is my kid having this trouble? in boys, this could happen in football, could happen in wrestling, things like that. Maybe even jumpers and things that are jumping and landing. Some of these things can happen. So it's not only girls, but the female adolescent in gymnastics, dance, cheer, those kind of things would be the most common category of people to have this. We're happy to evaluate and try to help you both identify that and really help get them feeling better and back in the game and do what's best for them in the long run as well.